Call it good afternoon. Mahalo for joining us today for the joint HHS and Housing Joint Committee on Monday, March 30th, 2026 at 1 p.m. We're convened in room 225 with my co-chair, Senator Chang. Following this, there is also another joint hearing with Energy and Intergovernmental Affairs, and following that, we have a Agriculture and Environment joint hearing, and following that, we just have a Health and Human Services hearing. This meeting is being streamed live, and all the subsequent meetings are going to be streamed live on YouTube. In the unlikely event that we must abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business later at 1 p.m. Wednesday, April 1st, 2026, in room 225, and a public notice will be posted on the legislator's website. To facilitate this hearing in a timely manner, as you know, that we have 4 hearings, we will be enforcing a 1-minute limit on testimony. I will be reading, and Senator Chang will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony, that we have all reviewed them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. And with that, I am allowing Senator Chang to proceed with his hearing.
Thank you so much, Senator San Buenaventura. We have one item or one pair of resolutions on the 1 p.m. agenda for the Joint Committees on Housing and Health and Human Services, SCR 160, SR 151, urging HPHA, DHS's Homeless Programs Office, Statewide Office on Homelessness and Housing Solutions, and HHFDC to create a housing ladder program to help individuals and families graduate into unsubsidized housing. We'll be taking testimony on both simultaneously. Our first testifier is HHFDC in support.
Good afternoon, HHS-EIG stands on written testimony in support.
Thank you. HPHA in support. Thank you. Statewide Office on Homelessness and Housing Solutions in support. Thank you. Lila Maurer in support. Is there anyone else wishing to testify on SCR 160 and SR 151? Okay, if not.
I have a question. Is anybody here from the Housing and Homelessness Solution? I don't see anybody. Oh, you are? Okay. Okay, because you're not June Yang, but so I have a question. So could you come on up here? That's the reason I asked whether or not you were here. So you're supposed to be, not you, June Yang, but go ahead, since you're representing June Yang, conducts those interagency meetings for the homeless coordinators. And I used to attend them before. And is that something that could be used as because it's already there, the interagency to create this homeless ladder plan?
Yes, I believe that would be one of our strategies and tools to work on this initiative with the other collaborating agencies.
Okay. Thank you. Ben Park, come on up. Since you're one of the people, your agency is one of the people who are supposed to be listed to create this housing ladder program. It doesn't sound like, it's just urging you folks to work together. But it doesn't sound like that there is a requirement that you folks actually come up with a housing ladder plan. Is there any movement towards that?
Afternoon, Ben
Yes,
Park
thank
with the
you.
Hawaii Public Housing Authority. I think we're going to take this resolution back to our directors. And I know we still collaborate now on how we transition from homelessness to public housing to Section 8 and then to getting to unsubsidized housing is not going to be able to fit everybody. But we will get back to the directors and work on that per the resolution.
Okay, and frankly, Housing and Homelessness Solutions, there is a bill moving, Senate bill that basically will fund you folks for another couple of years. But as part of that bill, you folks are required to come up with a plan to reduce statewide homelessness by 25%. I think I started off with 1 year, but it has since changed to 2 years. Is that something that you could integrate with this housing ladder?
Reducing homelessness is our top priority, particularly unsheltered homelessness. So we would work with our department and director to incorporate that into any plan developed under this housing ladder.
Okay, so it sounds like, because basically that's part of the housing ladder, right? From the homelessness to transition on up. Okay, that's basically it. I don't have any other questions.
Any questions for them?
Okay, Sandra, go ahead.
I know we're talking about the percentage, and we know you guys are supposed to be collaborating together, but what is a collaboration without the agencies that is out there all the time? We're trying to get this data and information. I know Senator Moriwaki talked about making sure that we get the data, share data. Not sure if that's your guys' department, but you know, when we have nonprofits dedicating themselves for houselessness or people that don't have homes, you know, I've been doing this for a long time, and maybe before I was senator. And you know, our homeless crisis got worse, but we're still giving a lot of money out there, and there's no accountability. So I don't know how you guys can collaborate with the rest of the people, but you know what my idea would be? Every single person getting money for homeless, take all their money back. Unless they can show us statistics on how they're reducing it. We can give you guys the 25%, but you guys don't even know the percentage of what we had helped anyway in the beginning. So even we make a resolution, which is a resolution, we're asking you guys to do this. The urgency, not just you guys, and not just you guys are here, but again, going forward, how it is an urgency, we're gonna tell these guys who we're giving them money, millions and millions of dollars, and half of that go to their paperwork, the other half, I don't know where it go, very small goes to the community. Reason why I say that is because with me, when I was serving on the neighborhood board in the Never Beach Lions Club, every dime that the Lions Club get, because we don't do it for profit, we do it for service. Those guys forgot that, who's doing this. So you guys can collaborate all you guys like, but the percentage that we're, because I like this bill, it's great. But again, how we gonna get results? And the results is lessening the amount, not growing. No, we're just blaming other things that's happening, but again, not only the cost of living, just not holding these guys accountable. Because I get a few shelters, you guys talk offline, that they're just a revolving door. Revolving door, kick them out, 2 years later they're back, revolving door. As long as they get the statistics, put in the statistics, get their grant, get their money, that's all they're worried about. Those guys are still yet on the streets. I still get the same homeless guys that went into the shelter, came back out, went to another shelter, came back out. There is no collaboration. So if this is right there to looking at these guys who finding out more homes, and we're gonna do the 25%, I support that, but again, you guys gotta figure out how we can do this. Hold these guys who taking the money from the state and our grants, hold them accountable. If cannot, then we gotta come up with a bill to cancel all the funds, because they top heavy. They have a lot of administration, a lot of money going to the administration. You know how you guys do that? Not you guys again. You know how you do this? You actually get out of your office and you go down there and you talk with them. Encourage them. Do not give them one handout, one hand up. That's it. But I want to see how this is going to work. And if it doesn't work, we need to collaborate as senators and representatives to see how we will cut everybody's budget unless they can show us results. That's how they get paid. Thank you. Thank you, Senator.
And I just have one more comment, Co-Chair. As you can tell, and as you could hear from listening to any city council hearing regarding their budget for homelessness, we've reached a point of compassion fatigue. And I know in Hawaii County, they're already starting to cut their homeless budget. And that's also the reason I required it on on when you folks, when the Office of Housing and Homeless Solution was asking for another 25 million or so with no plan on actually reducing. That's the reason we're requiring these plans. Okay, and for Senator Favella's edification, the 25% requirement I have required them to start with a starting point based upon point in time counts of this year, since they're starting it up again. Okay, basically that's it for, this is just a resolution. The other one is a bill, however, and if we don't, and the bill also required that further funding of the Office of Housing and Homelessness Solution is going to require basically a reference to that plan as to what we're doing about it, yeah? Just putting up kauhalas willy-nilly without any plan. Again, we've reached a point of compassion fatigue. Okay, thank you.
Thank you.
Thanks.
Okay,
All right,
to
so
you.
we go into decision-making.
Yes?
Do you accept quorum?
I don't have quorum, but because I have the other ones, we will defer decision-making until we reach quorum.
Okay, great. Well, we have quorum for housing, so, all right, so chairs having conferred, chair's recommendation for SCR 160 and SR 151 will be to pass this measure unamended. And I think there was some good discussion earlier, so maybe we can incorporate the concerns of Senators Favela and Co-Chair Sen Buenaventura into the committee report as well. Any questions or discussion? Okay, again, for SCR 160 and SR 151 for the Committee on Housing, chair's recommendation is to pass unamended. Chair votes aye.
Okay, Chair's recommendation is to pass SCR 160 and SR 151, both unamended. Chair Chang votes aye. Vice Chair Hashimoto is excused. Senator Elefante, I vote yes. Aye. Senator Rhodes?
Aye.
And Senator Favela?
Aye.
Mr. Chair, your recommendation is adopted.
Thank you.
And for Health and Human Services, we are deferring decision.
No, we're not.
No, we're not. We have quorum.
Any of yours or no's? None. Recommendations adopted, Chair.
Thank you very much. And with that, we are adjourning Housing and Health and Human Services. Calling the Health and Human Services, I believe, 107 calendar, until the other co-chairs of the other joint committees appear. First up, SCR 30, requesting the auditor to assess the social and financial effects of mandating health insurance coverage for brief cognitive assessments for individuals 50 years of age and older. First up, we have, excuse me. Auditor's Office providing request in opposition, I guess. Next, we have Hawaii Disability Rights Center in support, Alzheimer's Association in support, Lila Mower in support, Mansa Devaki in support, Barbara Service in support, Jerry Perone in support, Department of Health providing comments, and Johnny May Perry in support. Anybody else wishing to testify on SCR 30, requesting the auditor to assess the social and financial effects of mandating health insurance coverage for brief cognitive assessments for individuals 50 years of age or older?
Excuse me, Chair? We do have Kobe, Chuck, and Barbara in this
Okay,
room.
so, yes, Alzheimer's, please proceed.
Chair, thank you for hearing this bill, and Kobe Chalk on behalf of the Alzheimer's Association will stand on our written testimony and support.
Thank you very much. And I see Mr. Black. Are you here for SCR 30?
Yes.
Okay, please proceed. You have 1 minute.
All right. Yeah, fine. That's who I am, Mr. Black. And my wife and caregiver Barbara and I are living in the Noli on the Big Island. And members of the committee, I really wish I had received a brief cognitive assessment when I was 50 years old. 23 years later, I did get a brief assessment. And at that time, I was retired and covered by Medicare, which was very fortunate because that's when I learned that I was cognitively impaired and had been for some time. And that's when I became an Alzheimer's patient. Learning that my disease was in a relatively early stage of development allowed us to adjust to this new and frightening reality while I was still relatively functional. Our path has been much more positive than it might have been, and we are very grateful for this. For this reason, I strongly support this bill.
Thank you, Mr. Black.
Thank
Okay,
you for the opportunity to testify.
Okay, now we have Barbara Black, your wife. Please proceed. You need to unmute yourself.
Okay.
Go ahead.
Yes. My name is Barbara Black. I'm Peter's caregiver, and I'm strongly in support of SCR 30 because while we were stunned when we found out that Peter had Alzheimer's, that early diagnosis was a blessing for us. It let us plan for the future, and for Peter, give him access to one of the new Alzheimer drugs. And I had a chance to learn what I could learn about Alzheimer's and caregiving. And it's sort of a matter of equity when I think about this, that people who aren't eligible for Medicare but are already experiencing cognitive decline should have the opportunity to easily get early screening. Leads to earlier diagnosis, care planning, and access to treatment. So I respectfully urge you to support SCR 30 so all Hawaii residents have a better chance at early detection.
Thank you very much, Mrs. Black. Members, any questions? Anybody else wishing to testify on SCR 30? Okay, I have a short question of Kobe Chalk. Kobe, are you present? Alzheimer's Association.
I'm here, Chair.
Okay, did you see the auditor's opposition?
I did.
Okay, the big problem we have is that the House bill refers to a cognitive assessment and use the phrase including but not limited to, which then becomes super general instead of just saying a brief cognitive assessment.
Yes, Chair. So the reason for that is like Dr. Lewin's comments in the testimony. He mentions that anybody who might be getting Alzheimer's disease or have cognitive impairment should be able to get a cognitive assessment. So ideally, it'd be for those 50 and older. But if someone is, say, 49 and their doctor feels that, given their family history or whatnot, they should be getting cognitive assessments maybe even sooner, we wanted to leave that opportunity for them as well, although it would be less common.
Okay, so here's the problem. The problem is we are super specific because the prepaid healthcare plan that we need to protect that is really unique to Hawaii, and I think Massachusetts has something similar. We cannot just mandate services unless we know whether or not it's going to affect that prepaid healthcare plan. So having something, a bill that refers to something very general and requiring mandating coverage, it's gonna screw up our prepaid healthcare plan. So I would strongly recommend that next year you folks tighten the request. Okay, saying a brief cognitive assessment for those who are 50 years old or over. Okay, because otherwise, the state is not going to throw away our prepaid health care plan just to satisfy you folks.
That makes sense.
Thank you very much.
Thank you, Chair.
Any other questions? Okay, right now we're going to do a brief recess and get back to the 102 calendar. So the 107 calendar is recessed at this. Calling the 102 calendar joint hearing of Health, Human Services, and Energy and Intergovernmental Affairs. Present with me is my co-chair, Senator Wakan, and his committee members, Senators Richard, Senator Rhodes, Senator Chang, and the rest of my committee is my co-chair, my vice chair, Senator McKelvey and Senator Favela. First up, we have SCR 24, SR 21, supporting the governor's decision to join the West Coast Health Alliance to guide public health decisions. First up, we have Department of Health in support.
Good afternoon, Chair, Vice Chair, and member of the committee. My name is Nathan Ken. I'm with the Department of Health, and I offer written testimony and support, and appreciate this resolution.
Thank you very much. Next, we have Hawaii Public Health Institute in support.
Chairs, Vice Chairs, committee members, I'm Chris Coughlin from the Hawaii Public Health Institute. We're in support of this bill, this resolution as well. I think it comes at a great time. Hawaii's participation in the West Coast Health Alliance comes at a time when there's many public health professionals and medical organizations have expressed grave concern about some of the rollbacks coming out of the federal administration in regard to vaccines, reproductive care, chronic disease. The WHCA was formed specifically to ensure that public health guidance remains rooted in scientific evidence and that public communication is grounded in evidence-based research that protects the public health. So public health doesn't stop at state borders. Infectious disease crosses state borders, social health determinants, supply chain disruptions impact multiple states simultaneously, and we think this is a great resolution, and we hope you'll move it forward.
Thank you very much. Next, we have Teresa Armbruster in opposition. Teresa, are you present? I will name those who have registered first. Come on up, Teresa.
Aloha, Chair and committee members. I'm Teresa Armbruster, and I oppose SCR 24 and SR 21. I do not support the governor's decision to join this alliance because just because you're joining this alliance does not mean we're going to increase public confidence in vaccines. And it seems like this alliance is mainly going to be pushing vaccines and no other kind of health alternatives to build up immune system, healthy immune systems. There's more naturopathic ways too. And also, many are aware of what happened during COVID. The COVID vaccine alone had a lot of adverse reactions, serious injuries, and deaths. So even though you keep saying everything's science-based and evidence-based, well, one of the so-called experts, medical experts, is the American Academy of Pediatrics, which it seems like this alliance is going to rely on some of their guidance. And right now there's a RICO lawsuit against them for fraudulent vaccine safety claims. And in that lawsuit, there's also...
Thank you, Teresa.
Okay, thank you.
And
I do oppose it. Thank you.
Yes.
And I stand on written testimony. Thank you.
Thank you. And I did see what you said about the American Association of Pediatrics. Okay, Linda Miyata in opposition. Linda, are you present on Zoom?
Yes,
please
ma'am.
proceed. Okay, please proceed.
Aloha, I'm Linda Miyata. I am opposed to SCR 24 and SR 21. Vaccines are not the most effective health tool to prevent illnesses. There are many safe natural remedies to prevent illness without damaging side effects. I personally know of people who have been injured by vaccines who struggle today due to side effects, and one even died. Have you noticed the increase in autism, myocarditis, blood clots, and cancer? These are all damaging effects from vaccines. I had 7 teacher friends come down with cancer amongst only 50 us teachers. They all took the vaccine. This is not normal. Have you noticed more young people dying before their time? Do you know the ingredients in each vaccine? Ingredients have changed since we were kids. Military biodefense experts have confirmed in peer review that the measles virus in the measles vaccine is the product of gain of function. Have you studied the VAERS report to see how many people have been injured? It's heartbreaking. What other consequences will arise if we join this alliance? Will we lose federal aid and funding in other areas,
Thank
especially
you so much,
are
Linda.
we hurting or helping our
Thank you so much, Linda. Next, we have Kim Cordery, also in opposition. Kim, are you present? Yes. Come on up.
Aloha, Chair and Committee. Thank you for letting me have this opportunity to oppose. I'm opposed to SCR 24, and I'm opposed primarily because I do not believe that this is in the interest of the general public. I believe that it's the interest of the way that our governor is taking us. And as Linda said, I don't believe that it actually includes any of the healthy aspects of building a healthy immune system naturally. Our God-given immune systems are built on it's a natural health, not alone by vaccines. By vaccines, there are, as she said, many injuries and adverse reactions. So I am opposed to this, and primarily also because I believe this goes against our constitutional rights, that to have a board decide or have the government decide on our own health, I believe that is just not right. So I oppose. Thank you.
Thank you very much. Next, we have Cheryl Toyofuku in opposition. Cheryl, come on up. Okay.
Aloha, Chair and committee members. My name is Cheryl Toyofuku. I'm a mother. I'm a grandmother. I'm a retired registered nurse and a health advocate. I strongly oppose this resolution, SCR 24 and SR 21. This West Coast Health Alliance was in response to the lowering of the childhood vaccine schedule. And we all have heard many testimonies over the years about the adverse reactions from vaccines, many during the COVID time where there were a lot of deaths, many of our family and friends. I think our legislators, our lawmakers should do a little bit more research on the vaccinations and that it does not really build up our natural immunity. It's artificial immunity being injected into us versus natural. So it's like similar to SB 3133, which is forming an advisory committee that's promoting vaccines, or the American Association of Pediatrics that also promotes vaccines. But why are we focusing so much on vaccines for preventive health measures? There's so many other natural, non-toxic ways to build our ohana's health. So I strongly oppose this resolution. Thank you.
Thank you very much, Cheryl. Raina Laughlin in opposition. Raina, come on up.
Aloha, Chair, Vice Chair, and members of the committee. I am in strong opposition of SCR 24 and companion SR 21. The governor's decision to join the West Coast Health Alliance is not fairly representing the will of the people of Hawaii. A concern is how it will impose on our medical freedom, as it did during COVID-19, where public health decisions and mandates were made for us. A grave concern is the recommendations of vaccinations, which are terrible ingredients many of us don't want in our bodies or our children's bodies, such as aluminum, mercury, aborted fetal cells, and more. There's a lot of people concerned about vaccinations and the recommendations by the CDC or other health organizations that this alliance would align with, so people would should have the choice to choose their own medical decisions. This alliance would also give the governor to give standing orders, and that I have a problem with. Standing orders is not allowing us our own medical freedom. For these reasons, I oppose.
Thank you very much. Okay, Judith Clark in support, Brett Colbus in opposition, Terry Yoshinaga in opposition, Rita Kamakimura in opposition. Anybody else wishing to testify? Oh, come on up. Sorry.
This is my first time, sorry.
Okay, sorry about that. Identify yourself.
Good afternoon, Senator, Chair, Vice Committee. Thank you so much. I oppose this resolution.
Please identify yourself.
My name is Yeva Bambridge.
Okay.
And I oppose this resolution. I'm here because I believe I have a right to make decisions about my own body, and that's not negotiable for me. I don't want to be mandated to take something. I would like to choose. I am in excellent health. I take no medication. I'm asking you to protect that choice. Mahalo nui loa.
Thank you very much.
Have a great afternoon.
Okay, come on up. Okay, identify yourself.
I'm Loretta Dubin, and I say thank you, Chair and co-chairs and committee, for allowing me to speak. I am in very strong opposition to this West Coast Health Alliance. I myself have had family members that have passed away after getting the COVID shots. And so that's very recent in all of our memory banks here. Our body is the most important infrastructure we have, and that we have to steward. Okay, so we have to know what we're putting in our body. It is not effective and it is not safe. I've been a nurse for 50 years. And during the COVID years, when they were injecting people, the hibby-jibbies, they threw out the rules about how they even gave injections. And people were passing out at these little clinic sites. This is not a debatable issue, but thank you very much for hearing me out, and I hope you vote in the...
Thank you very much. Okay, nobody else having registered to testify in SCR 24, SR 21. Anybody else wishing to testify? Come on up.
Aloha, Chair San Buenaventura, Chair Wakai, and members of the Senate Health and Human Services and Emergency and Intergovernmental Committees. My name is Margaret Mejia, and I'm representing Hawaii Christian Coalition. Hawaii Christian Coalition is opposed to SCR 24 and SR 21 relating to the governor's decision to join the West Coast Health Alliance to guide public health decisions. First of all, we don't need the government to guide us in any of our individual health decisions. We believe in bodily autonomy and medical freedom. Second, we at Hawaii Christian Coalition would like to point out that the so-called science that Governor Josh Green is promoting is not real science. The last legislative session, over 2,000 people testified against HB 1118 because they want to make choices regarding vaccines for their children in schools. Governor Green said that vaccines are safe and effective. He said masks work and we should social distance. None of these things can be proven scientifically to work. As a matter of fact, the opposite is true science.
Thank you very much. Anybody else wishing to testify on SCR 30 and 39 and, excuse me, I just forgot which one we're talking about. SCR 24 and SR 21. Come on up. Please identify yourself.
Chairs, Vice Chairs. Jack Lewin, Administrator of SHPTA, and I just really support the governor's decision to join the Western Alliance. I think it's a very good thing for the people of Hawaii, and SHPTA strongly supports it. Thank you.
Okay, thank you very much. Anybody else wishing to testify on SCR 24, SR 21? Members, any questions? Okay, moving on, I now give it to my co-chair for the remainder of resolutions.
I'd like to walk us through the next pair of resolutions. They are SCR 8, SR 10. This is regarding building permitted for health and safety for older adults wanting to refurbish or renovate their homes. I have, is there anyone in the audience or online wishing to testify on SCR 8 or SR 10? Members, oh, yes, Dr. Lewin.
Thank you, Chairs, Vice Chairs, and members. SHPTA supports this effort on behalf for persons with disabilities. We think this just speeds up the process. We think that would be very helpful for fall prevention and for other kinds of issues if the resources are available. Thank you.
Thank you, Dr. Lewin. Is there anyone else wishing to testify on these two measures? If not, members, any questions? Okay, we're going to move on to the last pair of resolutions. They are SCR 90 and SR 85. It's regarding Kuputa-friendly parking accessibility. Is there anyone wishing to testify on these two measures? Not members, we have written testimony submitted by two individuals, both of whom are in support of this measure. If, give us a few seconds and we're going to take a brief recess prior to the vote.
Okay, recalling the Joint Committee on Energy, Intergovernmental, Energy and Intergovernmental Affairs and Health and Human Services. So for SCR 24, SR 21, chairs have confirmed and we do not have sufficient votes, so HHS is going to defer SCR 24, SR 21. Any comments, questions, concerns? Seeing none?
Same recommendation for EIG. Any thoughts, comments? If not, we're going to move on to the next pair of resolutions, SR 8, SR 10. The two chairs have conferred. We'd like to move these two resolutions along. It would really help those who are in need of renovation to their home, who are on the senior side of our community, to get the renovations they need done more expeditiously. So the chair's recommendation is to pass this measure, these two measures as they are. Any discussion? If not, Senator Chang, I vote yes.
Chair's recommendation for SCR 8 and SR 10 is to pass unamended. Chair Wakai votes yes. Vice Chair votes aye. Senator DeCoit is excused. Senator Richards? Aye. Senator Favela?
Aye.
Recommendation is adopted.
So for HHS, same recommendation, Vice Chair for the vote.
Okay, same recommendation as Senate Draft 1, or sorry, as is.
As is.
Noting the presence of myself and Chair San Buenaventura and Member Favela, all those excused and WRs are no's. Seeing none, recommendation is adopted. Sorry.
For the final two pairs of resolutions, SCR 90 and SR 85, we'd like to pass this measure out as they are. We'd like to help our seniors who need to get parking accessibility in various businesses around the state. So the chair's recommendation is to pass as is. Any discussion? If not, Senator Chang, I vote yes.
Chair's recommendation for SCR 90 and SR 85 is to pass unamended. Are the members present? Are there any objections or reservations? Seeing none, the recommendation is adopted.
Thank you.
For Health and Human Services, same recommendation, Vice Chair for the vote, Chair votes aye.
Okay, recommendation is to pass unamended. Noting the excused members, any WRs or no's. Seeing none, recommendation adopted.
Okay, and with that, we are adjourned for the Joint Committee on Energy, Intergovernmental Affairs, and Health and Human Services. Continuing the Health and Human Services 107 calendar, next up is SCR 35, SR 34, requesting the auditor to assess both social and financial effects of proposed mandated health insurance coverage for the diagnosis and treatment of autism and for applied behavioral analysis services. First up, for SCR 35, we have Department of Education in support. Louis Urchik, Hawaii Disability Rights Center in support.
Yes, thank you, Senator. I was really involved when the insurance mandate was passed. I'm trying to remember what year it was. I think Representative McKelvey was Senator McKelvey now. It was a representative. I don't know if you were in the legislature or not. Senator Baker was a big champion. It was the result of years of struggled advocacy. So at the time, the compromise that was reached certainly seemed reasonable. I mean, it's mostly for kids, and so the idea of the age cap and the dollar cap, as you can appreciate, that's how legislation gets made. But I think time has shown that it really does benefit older people. And it's also shown that this stuff isn't cheap. And so the dollar cap is is becoming a limitation. So I think it makes sense for the auditor to look into this issue and do an analysis and then give you some information to make a decision next year. Thank you.
Thank you very much. Next, we have Bayada Kristen Koba-Burt in support. Kristen, please proceed.
Thank you, Chair, Vice Chair, members of the committee. Kristen Koba-Burt on behalf of Bayada. I'll echo what Lou said for HDRC. At the time we passed this with Representative at the time McKelvey's support with an age and dollar cap. The important part being those are not enforced. Those are considered a violation under the federal mental health parity law. So currently, the entire population under private health insurance is able to access regardless of age or dollar cap. Currently, Bayada serves adult clients for ABA services. And so making sure that that's noted for the auditor's report, that that coverage already exists. It's really a matter of cleaning up the state law in the event that the federal protections were to go away.
Okay, thank you very much. Anybody else wishing to testify in SCR 35, SR 34? Okay, members, any questions? So my question is for Bayada. Are you still present?
Yes.
Okay, I think it was in your testimony that basically says that federal law already requires such coverage.
Correct.
Okay.
So the federal mental health parity law prohibits quantitative treatment limits such as age and dollar caps, and so they have not been enforced by the local health plans. The big thing that we want to make sure we're getting right in the state law is to remove those age and dollar caps. If the federal law were to change, those protections would go away.
Okay, thank you very much. Louis Urchuk, I have a question. According to Bayada, testimony, did you have a chance to review it?
I was just glancing at it this morning on a little bit.
Okay, because basically, they say that it's not necessary, except apparently they want to remove the caps on coverage. If we're going to remove the caps on coverage, then we're going to have the same problem as the prepaid health care plan limitation, right? Which means we cannot pass this this resolution, unless we have those limits. Otherwise, our prepaid health care plan is in jeopardy.
I honestly am not certain. I mean, I'd be happy. I know Kristen well. I mean, I'd be happy to talk with her and try to get back to you if that helps.
Okay, that's an insurance commissioner requirement. And if you look at the other ones, that's the reason why we need an auditor to let us know we're not. Yeah.
Right. That's why I thought the auditor's idea. I mean.
Okay.
You sort of can't lose by having the auditor do an analysis of that, right? You're not actually passing any law this year.
No, but we have to put limits on what the auditor can actually examine.
I see. In terms of the impact, you mean if it's open-ended, then the auditor doesn't know how far to look, whereas if you say we're going from 25 to 50 or something like that, yeah.
Okay, so we have a problem with an unending cap of insurance coverage.
Could you amend the resolution to put in a cap?
The bill has to match the resolution. The bill needs to be changed.
I see.
The underlying bill.
Because the resolution was based on the bill.
You're right. The bill is not in front of me. So, okay, you hear the problem, Bayada?
Yeah, is it possible for the auditor to essentially look at are caps currently enforced, and that answer is no, and then therefore there would not be the impacts if they were removed in state law?
So if it's a question of enforcement, it's not for the auditor.
Yeah.
It's basically for Office of Consumer Protection, right? And the insurance commissioner, but not for the auditor. The auditor only determines whether or not there is insurance coverage, whether or not we should have insurance.
Correct. Right.
Mandated insurance coverage.
Right.
Okay? Okay, thank you very much. Any other questions? Okay, at this time, we are going to recess the 107 since I have my co-chair here now for AEN. So we're recessing the 107 calendar. Calling the HHS-AEN 104 calendar. First up, we have, It's me. Is it me or you? Okay, me. Okay, first up, we have SCR 39, establishing the Joint Legislative Mattress Stewardship Program Design Working Group to study, evaluate, and make recommendations on the structure and implementation of a statewide mattress stewardship program. And I apologize, I should call my members, and I have co-chair here, Senator Gabbard, and his committee, Senator Rhodes and Senator Richards. Okay, so first up for SCR 39, we have Department of Health.
Hawaii Department of Health stands on our written testimony in support. Thank you.
Thank you. Next, we have Ted Boland in support. Johnny May Perry in support. Anybody else wishing to testify on SCR 39, SR 29? Seeing none, okay, members, any questions? Okay, moving on. Next up, we have Waimanalo Gulch. SCR 142, Department of Health providing comments. Okay, so this is SCR 142 and SR 134. And next we have Johnny May Perry in support. Anybody else wishing to testify on SCR 142, SR 134?
Yes, thank you, Chair.
Okay, Pikachu, please identify yourself and proceed. 1 minute.
I am the one and only Pikachu, Shelby Billionaire. They tried to scare me with a bomb, but they could not scare me. We still march for freedom, and we're fighting for Waimanalo, SCR 142 as well. So I had my written testimonial. It was late, last minute, so let me just bring it up real quick. And so I'll just be real quick, real brief for everyone, because we live in Waianae. We know all the garbage dump from all those tons of trash we see on Instagram is going to come to Waianae. Even though call it Waimanalo Gulch, we got issues, we got problems. So shout out to Senator Kurt Favela. I talked to the staff and team to keep me abreast despite everything we got going on. We still want to support everything you guys doing in the building. So we do have to establish the proper gear for the dust monitoring. This mask is not good enough to go. Obviously, this will fail because you got PM 2.5, PM 10s inside. So you got all that scientific data. I would need those hazmat suits like you're going on full gas mask gear if you could put me in there. But there is a free tour. I just signed up from the City and Waste Management. The city toured the trash. If anybody wants to join Pikachu, the city is going to pick us up in a bus and take us to all the tour sites for free to go see where they're going to put all this waste. So I invite you all to come out and join us, and please support this bill because Pikachu loves you all. Hearts, gotta catch him up. Chee-hoo! Yeah, you! West side, best side! Minute or less, I love you all. Bam!
Thank you very much. Anybody else wishing to testify on SR 134, SCR 142? Members, any questions? So I'm going to ask Senator Favela's question since this is his resolution. To the Department of Health. Could you come on up? So it looks like from your testimony, you folks have dust monitoring stations already, but not to the extent. Okay, I'm going to have Senator Favela because they're saying that they're doing enough, and you're saying not. Ask them the question.
So the last meeting we had with their expansion of their Waimanalo Gulch, their guys' dust monitors is not in the areas that is going to be affecting the community. So again, how much dust monitors do you guys have over there on that property?
There are none on the property. Sorry, I'm Barry Ching, I'm with the cleaner branch as well. There are none.
So then what?
There's one 3 miles away.
How much?
There's one
3 miles
particulate
away.
monitor 3 miles away.
And what they're monitoring?
They're monitoring.
Particulate matter, which is dust.
Oh, understandable, but that's 3 miles away. We like know when it's leaving the dump, what is being collected. I understand 3 miles away, but how we know is that all coming from the gulch?
We don't know if it's coming from the gulch.
That's what I'm saying. So when we did dust monitoring when I was working construction, we was doing Kapolei. We never do them in Never Beach. We did them right in the area of Kapolei, so that they know how much red dirt was going on the houses, what they was ingesting, and the Hawaii University of Hawaii had done the research to let us know why things was in there like strychnine or whatever. There's nothing around the gouge for decades. People have been getting sick around PVT and that gouge. And again, we get them 3 miles away. So the recommendation was to have it in an area that you guys can actually monitor it so we can know what's happening and what's going on over there. Our families are sick and dying. And our area over there, you're expecting life expectancy is 10 years less than anywhere else. So if anybody like volunteer, raise you guys' hand, we can put one dump site in your community. Because our community is suffering, my family is dying. So we're asking this, and you guys just come over here and say, oh, we get one at 3 miles away. Is that designated for Waimanalo Gouge? Is that 3 miles away?
It's not specific to Waimanalo Gulch, it's a regulatory
Yeah,
monitoring.
that's what I'm saying. So this resolution, if you guys understand it, it's for Waimanalo Gouge. Because again, we need to protect, the Department of Health need to protect the people on the Waianae Coast, people that are driving there, people that are visiting there. It's not happening. So again, when are we gonna stop when we don't have any more of our people living there? Right, they're gonna expand this gouge whether we like it or not. So the provisions from the Department of Health should say, hey, you guys wanna make this, you guys need to put this in. Recommendations should come from you guys, telling the city that you guys need to put these provisions, or you guys cannot extend it. I don't even know why. Again, we've been going this along, a lot of mayors change, but then when I talked to the mayor, he said he was gonna look into it, but looking into it and doing it is two different things. You know, we people dying over there. So, I mean, if you can go look at the statistics, it talks about 10 years. Like, and most of the landfills, let's go give you guys a brief. Most of the landfills in rural poor areas. What do you think? We get planting property on the other side of the island. We get Cocoa Head Crater, we get Diamond Head. You know, how come we don't put those in there? We got a little landfill over there so they can take their own Opala. But they're not, because you guys are gonna have attorneys and all these other people that get money, take you guys to court. And the city. But that's okay. Keep going to dump. That's okay if the Hawaiians and the locals on that side die. See? So this is something that you guys should make the recommendation to the city and county of Honolulu from the Department of Health, saying that we have too many people getting sick. Go to Waianae Comprehensive. Put the data. They have it. PVT, respiratory, eczema, heart disease, kidney disease. Oh, no, because of what they eat. That's what they're going to say, what they eat. Well, that's not you guys, but the city said that. Oh, it's because they help what they eat. No. Federal guideline says 10 years less of your life expectancy if you live around or near a landfill. Because we don't have accounting of what actually is going into the air or what people are breathing. That's the reason why this resolution, because we went to the meeting in Waimanalo, and the guys that promote Waimanalo, the disposal guys that do Waimanalo, they have no answers. They have no answers for the community. So again, we want something from you guys, even though you guys, I guess, not saying you guys have 3 miles away. But we don't want 3 miles away. We want something that's going to be dedicated to that area that's causing contamination to the people. And that's the reason why this resolution was made. That was what the community was asking at that meeting, and nobody from the city or anybody wanted to say anything. So I told the mayor, and I tell you guys that that's the way this resolution was built. Because people is getting sick and dying in that area. So that's my thing. So again, are you guys going to be able to work with the community and the mayor to bring something closer? Or are you guys just going to keep with you guys generic 3 miles away and hopefully the team monitors something in the air that's causing people to die on the west side?
The Waimanalo Gulch landfill, they would be responsible for fence line.
Right?
monitoring.
What is your guidelines? Okay, you guys talking about, what is the Department of Health guidelines?
Yes.
You guys do it for PVT. PVT gets some monitors and some dust, water, particle things that barely works. But what is the guidelines that the Department of Health is giving to the city and the gulch to prevent people from getting sick and dying? Do you guys know what contamination is coming out of the gulch? When was the last time you guys tested up there?
Okay. You heard our concerns.
Yeah, that's,
Yeah, so that's what
we have
I
our
want.
regulations.
I want you guys to bring something up, because if they continue to dump rubbish, we gotta have some guidelines for somebody, and you guys are the Department of Health.
Okay. Thank you very much. Any other questions?
Yeah, before they go, so you were saying that,
Senator Rhodes.
that the operator of the of the landfill is supposed to monitor at the perimeter of the gulch, or the perimeter? What were you saying?
You know, we wouldn't do fence line monitoring. The
You
the
would?
landfill operator would.
Are
do
they?
that, yeah.
Are they doing fence line monitoring?
Well, they have.
It's not in their permit right now, but
Okay,
they do
so
fence line monitoring.
if they don't monitor, then does the Department of Health, are you supposed to step in and monitor, or what's supposed to
We
happen?
have fugitive dust emission limits in their permit, that it's not supposed to go beyond the lot line of the property boundary, and we enforce that.
Okay,
So there's been minimal complaints.
As Mike's stating
From
that the
landfills.
permit conditions, which we feel are sufficient, it's 2 permits with our branch and the solid hazardous waste branch. There are conditions that require them to control dust.
Okay.
Covering it, suppressing
But
dust and all this.
But you're saying that, you're saying the
The regulations are that the dust cannot cross the property line.
Okay, so
It's
you-
not about fence line monitoring, sorry. I think we got off on that. It's, we're talking about fence line monitoring. It's the regulations that, there are conditions and requirements that they cannot,
So
no one can have
how
dust
do you
problem-
know that
problem.
there's no dust getting past their
And
fence
that's the
line?
difficult part, Senator, is that we rely on the community to be our eyes and ears and report when they see things. And we understand, Senator, that it seems like we're just reactive, right? We cannot have a person there all the time.
Oh, no,
We
we're not
cannot put a
asking
station-
that.
Well, I don't know if we can, but we understand that you're asking for stations and all that.
But
I
you
think
require
what
as
we-
part of
what-
the permit
what
though,
we
right?
tip-
There you
yes.
go.
So you
That's
cannot,
Oh,
what I'm saying, change the rest of them, do that.
You guys giving out permits, like I told the mayor, people, you guys give them out like candies. You guys don't really
Okay,
modify it?
so, I'm sorry.
Okay,
Sorry,
let's go.
sorry.
Let-
Can I
let
finish my?
Senator Rhodes
Sorry,
finish her
So
question. His question.
so the permit says they're not supposed to let dust over the line.
Yes.
So that part of it's already permitted, there's already a condition in the permit
Yes.
about that. But then how do you know that that's being enforced? You're saying that it's just complaint driven.
yes, that's, unfortunately,
And
that's, so we understand the frustration. I think there are places that are like this. And
Does it
we-
have to
we
be,
rely-
does state law require that it be complaint driven, or is it something that you can go monitor on your?
I don't know the answer to that. I don't think the law tells us that we can, but I think,
It's in our rules, our Hawaii administrative rules.
That you can go and monitor it yourself? That you
No,
can go,
it's just by visual.
I'd say, okay, all
Okay.
right.
but you're right, it's more or less complaint driven. I think that's what we're saying.
Well, but that's the way it is with everything.
Yes, yes.
I mean, same thing with
We don't-
litter and traffic, it's
Yes,
usually
we don't have a
complaint
monitor
driven.
everywhere.
But here you have a permit hook.
Yes.
Yeah.
That's the thing, that's
It's
the
a permit
difference.
requirement, yeah.
I mean, so that's the route I think, hopefully you guys.
Then the
address.
question is who enforces the permit?
It would be, well, yeah, but it would be violation of the permit would fall upon you guys, and I'm sure you
Right.
guys
Yeah.
inspect
Inspector
for
goes out
compliance. You have an
there.
actual inspector.
And give a
Right.
field
Right.
citation.
And then again, that's complaint driven, right? Because they normally would mow.
But they also do your due diligence, the
Okay.
readings of the air station, right?
So let's go back to the resolution. The resolution does require them to work with the county regarding that, which is the way he drafted it. Okay, any other questions?
Sounds like a plan.
Okay, moving on. Okay, that's it. So are we ready to proceed with decision making? So for SCR 39, SR 29, Chair's recommendation is to pass with amendments per Department of Health testimony. We're gonna remove all references to the word joint. We're gonna just make them the chair and responsible for this stewardship program. Is that okay with the introducer? Okay. And technical non-substantive amendments needed for clarity and consistency. So pass with amendments. Chair votes aye, Vice Chair for the vote.
Okay, SCR 39, SR 29, recommendation is Senate Draft 1, noting the presence of myself and you and Senator Favela. Any WRs or noes of the present members, and all others are excused. Seeing none, your recommendation is adopted.
Same recommendation for AEN. Any discussion? Chair votes aye. Vice Chair?
For SCR 39 and SR 29, passing unamended, oh no.
No, with amendments.
With amendments.
Yeah, they're all good.
Chair votes aye, Vice Chair votes aye, Senator Coates excused, Senator Rhodes.
Aye and aye.
And Senator Awa.
Aye.
And same with the SR 29. Chair, you have 4 in favor, motion is adopted.
Thank you, members.
Okay, for SCR 142, SR 134, we've had robust discussion. Chair's recommendation is to pass with amendments. Since there is no appropriation, we're going to amend the resolution on line 36, page 2. Instead of requiring Department of Health to establish, we are going to require them to recommend. So replace the word establish with recommend, thus monitoring stations. Okay, otherwise, no other amendment. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Okay, recommendations on the resolution before us are to pass with amendments. Noting the previously excused members, any WRs or no. Seeing none, recommendation adopted.
Same recommendation for AEN. Any discussion? Chair votes aye. Vice Chair?
On SCR 142 and SR 134 of the 4 members in attendance, anybody voting with reservations? Any no votes? Chair, you have 4 in favor, motion adopted. Motion's adopted.
And with that, the Joint Committee on AEN and Health Human Services is adjourned. Recalling the 107 calendar on Health and Human Services. Next up, we have SCR 18, requesting the auditor to assess the social and financial effects of proposed mandated health insurance coverage for intravenous ketamine therapy to treat depression. First up, we have SCR 18, Office of the Auditor providing comments. Anybody else, nobody else having registered or provided testimony to testify? Anybody else wishing to testify in SCR 18? Okay, seeing none, moving on. Next, we have SCR 76, requesting the auditor to assess the social and financial effects of mandatory health insurance coverage for biomarker testing. So first up, we have Alzheimer's Association of Hawaii. In support, Colby Chalk, please proceed.
Chair San Buenaventura, Vice Chair McKelvey. I'm Colby Chalk on behalf of the Alzheimer's Association, and we'll stand on our written testimony in support. Thank you.
Okay, thank you very much. Next, we have Cynthia Au, American Cancer Society Cancer Action Network in support. Cynthia.
Cynthia Au, ACS CAN, and Town Support, and SCR 76.
Okay, thank you very much. Next, we have Primo Castro, Biotechnical Innovation Organization in support.
Not present, Chair.
Nope, not present. Next, we have Pedro Haro, American Lung Association in Hawaii in support. Pedro. Eric Abe, Hawaii Primary Care Association in support. Hawaii Women Lawyers in support. Elton Fukumoto, American Cancer Society Center Action Network in support. Maui Cancer Resources in support. 4, 5, 6, 7, 8. And 10 other individuals or so in support. Anybody else wishing to testify in SCR 76? Come on up, Dr. Lewin.
Chair San Buenaventura, Vice Chair McKelvey, members. We've been seeing this legislation for the last 4 sessions, legislative sessions, and there's probably some common sense to it. I mean, the FDA does have testing and drug indications for various medical conditions. The idea is around mandating the coverage, but certainly the coverage is needed for heart disease, cancer, neurodegenerative disease, and other diseases. We might want to ask the auditor to look at how routinely this is being covered elsewhere, and whether there are impediments like prior authorization that get in the way of making this coverage here. But certainly this is standard of care for those diseases. Thank you.
Thank you very much. Okay, anybody else wishing to testify on SCR 76? Okay, members, any questions for biomarker testing? Next up is SCR 51, requesting the auditor to assess the social and financial effects of requiring health insurance to provide coverage for medically necessary proton beam therapy for cancer treatment. First up, we have Office of the Auditor providing comments. Okay, anybody else? Nobody else having registered to testify. Anybody else? Come on up, Dr. Lewin.
Chair and members.
all of our testimony didn't get uploaded this
Okay, so
properly.
SR 51, proton
I just
beam
wanted to
therapy.
say that, that for the Pacific, maybe we could use a proton beam machine here. Typically, they're only available when there's a population of about 3 million people or more. There are newer, the auditor might want to look at the fact that there are newer proton beam technologies that might become available here if we collaborated together.
And bring it
Because they're
over.
so important for pediatric cancer, but for other a number of other cancers. But we're not quite ready, but I think the time may come soon. Thank you.
Thank you very much. Anybody else wishing to testify on SCR 51? Members, any questions? Okay, moving on. SCR 150, requesting the governor to obtain a controlled substance exemption from the Drug Enforcement Administration for registered medical cannabis patients and registration waivers for state licensed dispensaries. First up, Akamai Consulting in support. Please proceed, Dr. Otto.
Aloha, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify on this resolution. You have my written testimony and strong support. I just wanted to add that I don't believe the department or the AG submitted written testimony to your committee on this measure. So at least they didn't object, which is a good sign and perhaps an indication of a policy shift towards protecting the interstate medical use of cannabis. In any case, I'm happy to answer any questions you may have about why this is such an important measure for our medical cannabis patients, the dispensaries, and the future of medical cannabis in Hawaii.
Okay, thank you very much. Next, we have Courtney Cassier in support, Manolo Morales in support, Helen Higa in support, Wendy Gibson, Vivani in support. Anybody else wishing to testify on SCR 150? Members, any questions? Okay, moving on. Next, we have that's SCR 150 and SR 141. Next, we have SCR 119, requesting the Hawaii State Center for Nursing to conduct a study compiling recommended safe patient staffing ratios. First up, we have Hawaii State Center for Nursing providing comments. Laura Reichert.
Aloha, Chair. This is Laura Reichart. I am the director of the Hawaii State Center for Nursing. I asked for guidance from the committee. First, we welcome the opportunity to do this report. Our mission is collaborating on fostering workplace conditions that to support nurses to remain in a fulfilling profession. So I think we're well positioned. The first clarification I seek is this only for hospital nurses or is this nurses across all different settings? The second is I have a concern with the request for a dashboard of the organizations I've provided in my testimony that I found 13 that go beyond what was in the resolution. 9 recommend both strategies and ratios, and then an additional 4 only recommend strategies. So that's going to be hard to put in a dashboard. I'd prefer to provide a repository so that this is accessible, but not use the dashboard because it will not include the strategies that are very important. And then finally, I asked for clarification. In the resolution, it talks about nursing professional organizations, state regulation, and international regulation. Those are all very different methodologies. So if we could focus on one, that would be preferred. I just want to recommend the Legislative Reference Bureau study that already did the state regs.
Yep, I read your very lengthy written testimony. Okay, next up.
Thank you.
Thank you. Rosalie Agassi, Hawaii Nurses Association, Local 50 in support. Rosalie, are you present on Zoom?
Not present, Chair.
Okay, Terralyn Luke, Hawaii Nurses and Healthcare Professionals in support. Terralyn.
Hi, Chair. Right here.
Okay.
Terralyn from the Hawaii Nurses and Healthcare Professionals. I stand on the testimony that we submitted, and there are several other of our members that have also strongly supported this bill. It is a way for retention, definitely for our members that continually leave the workforce at an earlier age based on the working conditions currently in our community.
Thank you very much. Next, we have Linda Beechenor, Hawaii American Nurses Association in support.
Thank you, Senator. Yes, I am Linda Beechenor from Hawaii American Nurses Association. Speaking for the 17th.
Why don't you come on up if you're going to say something other than stand?
I will stand on my testimony.
Okay, thank you very much. Okay, Randy Pereira, HGA in support. Octavia Price, Kaiser Permanente in support. Marisa Jacobs, HNHP in support. Charles Kimball in support. Paul Hine in support. Kaylee Berg in support. 3, 4, 5, 6, 7 individuals also, all in support. Tani and Ida in opposition. Anybody else wishing to testify on SCR 119, SR 112? Members, any questions? So,
Aloha, Senator San Buenaventura and Vice Chair and members of the committee. I did submit written testimony and I stand by it.
thank you very much. Thank you very much. Okay, members, any other questions? Anybody else wishing to testify on SCR 119, SR 112? Okay, real fast question for the nurses. Did you read Laura Reichardt's written testimony? Do you have any problems if we adopt HCR 105 or HR 97 instead? It just clarifies what they are required to do. Same thing, except it clarifies.
Yes. Yes.
You have no problems?
No problem.
Thank you very much. Okay, moving on. SCR 149, SR 63, requesting the Department of Health to establish an informal working group to assess the services and funding necessary to address the needs of complex patients who at least have 2 or more diagnoses that include substance use disorders, mental health disorders, or chronic physical illness. First up, we have Department of Health. Okay, next we have Hawaii. I see Alan Johnson, come on up in support. I believe this is your reso.
I retired, but you can't get rid of me.
There you go.
Well, thank you, Chair, Senators. I'm Alan Johnson with the Hawaii Substance Abuse Coalition. We really appreciate the opportunity for this transformational grant because this is a major problem in Hawaii. We treat substance abuse over here, we treat mental health here, we don't treat them together. 54,000 people are not getting that treatment for many years because what substance abuse does, we only treat the severely mentally ill. So substance abuse has the capability to treat this, but we're not treating people with bipolar, PTSD, with diabetes and cancer and substance abuse. And so now the federal government is saying if the states that develop a pilot grant, they'll fund a transformational grant for 3-4 years. That funding will set the rates and structure so Medicaid can take over and pay for this. It's a huge opportunity for us to be proactive. And this is your homelessness, this is your EMR, this has been the solution for years. Thank you for this opportunity.
Thank you very much. Next we have Hawaii Disability Rights Center in support. Thank you. Brian Baker, Hinamauka in support. Leland Brady, Aloha Independent Living Hawaii in support. Anybody else wishing to testify on SCR 149, SR 63? Come on.
We are in support.
Thank you very much. Anybody else wishing to testify on SCR 149? Come on up, identify yourself. This is relating to complex patient model. Yeah.
Yes, Loretta Dubin is RN. What I've noticed, and this is from working here since the 80s, is they got rid of having these managers, like case managers, back in the, when was it, late 90s, early 2000s. And that has caused innumerable amounts of problems. So I'm in favor of this bill. But I do want to see some managed care happening, which is follow-up for these patients. Because you have the substance abuse on one hand, you have the mental health here, and nobody overseeing this.
Yeah.
And it's caused a lot of problems. We won't go into all that, but thank you for giving me the opportunity to voice that.
Thank you very much. And I think Alan Johnson agrees with you because it's his resolution to create this informal working group. Okay, anybody else wishing to testify on SCR 149 and SCR 149. Members, any questions? Seeing none. Next, we have SCR 63, requesting DCAB to study the healthcare communications needs of and develop guidelines for individuals who are deaf, hard of hearing, or deaf-blind. First up, Louis Urchik in support.
Support.
Thank you very much. Leland Brady, Aloha Independent Living Hawaii in support. Lila Moore in support. Anybody else wishing to testify on SCR 63? Members, any questions? Moving on.
Shipta has late testimony in support.
Okay, and this also includes SR 57. Thank you very much. Okay, members, any questions? SCR 63, SR 57. Okay, seeing none, moving on. SCR 75, requesting Department of Health to lead the statewide coordination of services and supports for fetal alcohol spectrum disorder. First up, we have Hawaii Department of Health providing comments. Okay, Judiciary providing comments. Fasting Group, Amanda Lunan in support. Come on up.
Aloha, Amanda Luning, Hawaii FASD Action Group. I'd just like to add in response to the Department of Health's comment that it was Act 192, not 193, and that we are running that project, and that we did submit our reports to them for the first year that include state-based coordination as a recommendation, because the assumptions that were made under that, and some of the assumptions that were made under that initial pilot were not the way that the project was submitted, because we knew we didn't really have capacity for that. So if you look at the reports that are attached to our testimony with a little QR code, they have been published and they're on our website. They were provided to the Department of Health in October and then again in December, and also to the folks that supported the Act 192 in the first place. So those are reports that they can use already for what is being asked in this resolution in relationship to the coordination and then the planning.
Thank you very much. Okay, next we have Louis Urchik in support.
Thank you. Senator. Now, I know you were in the legislature when Act 192 was passed, because you were the major champion, and that was a huge accomplishment and victory for the FASD advocates. So since that time, they've done a great job, but what's happened is that it took like over a year to release the funds. The Department of Health kind of dragged their feet, so it threw them behind. And what's happened also since that time is, they can tell you better than I, but my understanding is that there was a federal legislation passed that provides funds if the state would have an official coordinator, and when we talk to the Department of Health, they don't really know much about that. So I see the thrust of this resolution as asking the Department of Health to step up and do what they should be doing, because this should be a priority. It was to you, and it is to us. And there's a lot of frustration that the state is not making the progress that it should in terms of actually getting services. So that's why the resolution was introduced.
Thank you very much. Next, we have Alan Johnson, Hawaii Substance Abuse Coalition in support. He left. Brian Baker, Hinamauka in support. Jared Ellis in support. Anybody else wishing to testify on SCR 75, SR 69?
Thank you.
Chair,
Vice Chair, members. The shifted late testimony we'll get to you at some point, but we just think that this is an underdiagnosed issue. And so we like to, I would defer to the Department of Health in terms of the resources they have. We think we need to apply resources to this, particularly to increase the rate of diagnosis in the prenatal space, so that we can start early treatment later when it's needed. And we think it's a need. Thank you.
Hey, come on up. Okay, identify yourself.
Hello, Chair, Vice Chair. My name is Ivan Louis Kwan. I urge adoption of the resolution. Many years ago, I served on the board of the March of Dimes. We believe that the March of Dimes, that there was a real nexus between birth defects and the consumption of alcohol. What I thought was missing in our interactions back then are the efforts that it's called for in this resolution. More specifically, participation by organizations that have capacity, such as the Department of Health, Human Services, Education, Judiciary, and also coordination among these agencies. And third, training of skilled professionals, increased awareness of education. I have a hard time believing that pregnant women would continue to consume alcohol if they understood that drinking would cause damage to their babies for life. And so that's why I believe this resolution is so important.
Thank you very much.
Thank you.
Okay. Anybody else wishing to testify on SCR 75? Come on up. Okay, you need to identify yourself too.
Aloha, good afternoon, Chair, Vice Chair, and members of the committee. My name is Darlene Chanoscovo, and I'm a volunteer advocate for FASD for almost 10 years, diligently working and tirelessly advocating for this population. I recently have done interviews 31 doctors, pediatricians, and PCPs, and none of them diagnosed. Also, according to the report of the Department of Health, we have an FASD unit that doesn't exist. And with Act 192, very critical in this portion, we need to coordinate because they do not know where to send these children and what to do. So thank you for the opportunity to testify.
Thank you very much. Okay, anybody else wishing to testify on SCR 75, SR 69? Members, any questions? No, Department of Health isn't here. Well, no, but they're different parts of Department of Health will testify. Yeah. Okay, thank you very much. Okay, moving on. Yeah, they're the elephant in the room that didn't show up. Okay, SCR 21. Requesting Hawaii Health Systems Corporation's East Hawaii Regional Healthcare Systems to conduct a feasibility study on establishing a rural health clinic or comparable rural health access point to serve the Volcano community. First up, Lanikai Brewer and Company in support, Volcano Community Association support, James Morgan Volcano Community Association, and Kathy English, Cooper Center Council in support. Marcia He, are you present on Zoom?
Not present, Chair.
Okay, and we have 3, 4, 5. Okay, like the entire Volcano community. Okay, okay. Melissa Kuntz, are you present on Zoom?
Not present, Chair.
Okay, so over 20 other individuals, all in support. Anybody else wishing to testify on SCR 21 and SR 18 and SR 18? Okay, members, any questions? Nobody to ask questions of, so we're gonna move on. Next, we have SCR 7. This is Imalta. Affirming and supporting requirement that hospitals provide life-saving emergency care to pregnant people, including reproductive and abortion services, when such care is medically necessary to stabilize a patient under the Emergency Medical Treatment and Active Labor Act. First up, Hawaii State Commission on Status of Women in support. Okay, Hawaii Public Health Institute in support. Chris Cofield, come on up.
Hello, Chris Caulfield from the Hawaii Public Health Institute. We're in support of this resolution. The Emergency Medical Treatment and Active Labor Act, EMTALA, was established by Congress in 1986, and as stated in the resolution, it applies to all emergency medical conditions, including pregnancy-related emergencies. It requires hospitals to provide stabilizing treatment using standard care and defers to a physician's clinical judgment in determining what treatment is necessary to stabilize a patient. We would note here that reproductive care is health care, and this resolution helps to address legal confusion. There was a study that came out in 2025 examining EMTALA and obstetric emergencies, and it found that state abortion laws may undermine federally protected emergency care or conflict with federally protected emergency care and create this unnecessary uncertainty, uncertain climate for clinicians who are attempting to comply with EMTALA stabilization requirements when it comes to reproductive care. This state has a long legacy of protecting reproductive rights. This is a resolution, just another step in that legacy, and we hope that you will move it forward.
Thank you very much. Okay, next, Youngie Overly, AAUW and support. Mandy Fernandez, ACLU of Hawaii and support. And we have Hawaii Women Lawyers in support. Teresa Armbruster in opposition, come on up.
Aloha, Chair and committee members. I'm Teresa Armbruster, and I oppose SCR 7, SR 7. And I stand on my written testimony, but I do want to highlight a few things. There was a Supreme Court case, Texas versus Becerra, and they specifically looked at the definition, the EMTALA's definition of emergency medical condition for a pregnant woman. And it stated that a condition that threatens the health of the pregnant woman or the health of the unborn child. And they noted that that creates an obligation to stabilize both the mother and the unborn child. And also it stated that EMTALA does not explicitly state that a hospital must provide abortion care as a necessary stabilizing treatment for every emergency medical condition. And also EMTALA does not specifically state that religious exemptions are not allowed. This would violate a person's constitutional right of free exercise of religion or the Religious Freedom Act. And also, it's very concerning that you're requiring all hospitals compliance, especially regardless of their religious affiliation.
Okay, thank
And
you.
abortion is not standard of care for religious hospitals.
Very
Thank
much,
you.
Teresa. Okay, anybody else? No one else having registered to testify? Okay, I understand. Okay, so come on up. Come on up. You haven't registered, but you need to say what your name is. This is for SCR7, SR7.
Yes.
Okay, please
My
testify.
name is Raina Laughlin. So
Okay.
good afternoon, Chair,
Good
Vice
afternoon.
Chair, and members. I strongly oppose this. If this passes, there will be an increase in unnecessary deaths of unborn babies and danger to the mother and other medical decisions that may not be necessary for patients. Physicians' determination of life-saving emergencies, we need to understand, is not always accurate, which is the case in my personal experience and those of my 3 friends. Physicians are quick to call a situation life-threatening and to recommend abortion. In my situation, when I was 5 months pregnant, they told me that my unborn baby was going to most likely, probably not survive. So they actually didn't just encourage and recommend, they were pushing me to get an abortion, as they did with my 2 other friends, or 3 other friends, in which case my baby did not survive, but I had the choice to continue full term and take that chance. And my 3 others, they all had healthy babies.
Thank
so
you very
for this
much.
reason, I oppose.
Come on up. Okay, identify yourself.
Loretta Dubin, RN, labor and delivery nurse for many years. I have had opportunities to see a lot of vaginal bleeding, okay? And I myself would not have my grandson now if my daughter-in-law had gone to an emergency room, had presented with vaginal bleeding, and they would have pushed her, just like they did with the last testifier, into having a DNC. Because the placenta is so wonderfully made that the cord, if there's bleeding in there, the cord will move over to where it needs to go so that the life of the embryo and or fetus, if it's that far along, will continue to survive. So I am vehemently against this because there are many cases where the baby has been viable, even delivering at 20 weeks. We have a lot of technology now. And who's going to fund this misoprostol? That's like to...
That's another bill.
Yeah.
That's another
Okay, right. Well,
Okay,
thank
you
you
very
so
much.
much for your time.
Thank you very much. Okay, anybody else wishing to testify on SCR7, SR7? Come on up.
Aloha Chair, members of the HHS Committee. My name is Margaret Mejia. I'm testifying on behalf of Hawaii Christian Coalition. We oppose SCR7 and SR7 as it is written. We'd like to suggest an amendment as recommended by Hawaii Christian Coalition Dr. Richard Bartlett, who's been an emergency room doctor for over 37 years. We'd like to remove the word preeclampsia on page 1, line 10. According to Dr. Bartlett, an emergency abortion due to preeclampsia is not life-saving emergency care. Dr. Bartlett said that the solution for preeclampsia is for the mother to give birth, not to have an abortion. Abortions given to moms with preeclampsia would result in tens of thousands of unnecessary deaths of keiki in Hawaii. And so, yes, so we oppose it as it is written, but we're open to amendments. The other 2 cases, he said, besides the preeclampsia, he said that's the baby's outside of the uterus, so it's not really an abortion. The baby would die anyway.
Thank you very much. All right. Anybody else on SCR7, SR7? Members, any questions? Okay, moving on. SCR45, urging the Department of Health to coordinate the stockpiling of a 3-year supply of mifepristone. First up, Department of Health providing comments. Please proceed.
Good afternoon. I'm Matt Shim, Department of Health. We will stand on our testimony providing comments, and I'm here to answer any questions. Thank you.
Thank you. Hawaii Public Health Institute in support.
Chris Kaufman from the Hawaii Public Health Institute. We're in support of this resolution. Mifepristone is safe. It's one of the most extensively studied medications in modern medicine. It's been approved by the U.S. FDA for more than 2 decades. The FDA in numerous peer-reviewed studies have consistently found that the medication is safe, it's effective. It has a safety profile that compares positively with commonly used medications. And it's important to note that it's used not only for abortion care, but also for the management of miscarriage and other pregnancy-related medical conditions, which makes it an essential medication for reproductive health care and emergency obstetric care. Access has been the subject of ongoing federal litigation, as you're all aware, which leads to policy uncertainty. There are legal scholars and public health practitioners across our country who have warned us that changes in federal policy or supply chain disruptions could affect access to the medication, even in states where abortion remains legal. So we think access to mifepristone is essential. It's critical for reproductive health care, for health care in general, and we hope that you will move this resolution forward to support having a stable supply of it here in our state. Thank you so much.
Thank you. Komal Soin in support. Hawaii State Youth Commission Public Health Committee in support. Is there anybody on Zoom for Hawaii State Commission Public Health Committee?
No one present, Chair.
Teresa Armbruster in opposition.
Aloha, Chair and committee members. I'm Teresa Armbruster, and I oppose SCR 45, SR 44. Well, I oppose all abortions, chemical and surgical, but in this case, the stockpiling on the mifepristone, you don't necessarily have to stockpile for 3 years. That's going to be pretty expensive with our tax dollars using that. But also, I do want to emphasize the chemical abortion risks. They keep saying it's safe and effective, but there's 4 times more complications with chemical abortion versus surgical. And also there's 22 times increased rate of serious complications that are stated in the label, saying it's on the label itself for mifepristone, saying it's just mild, but there's 22 times more complications that they haven't even addressed. And also that there's 11% experience serious adverse health, such as infection, sepsis, hemorrhage, and there's even some deaths. So I really want to look at some of these risks before you just stockpile on this. And also, it's saying...
Thank you very much, Teresa.
Thank you. Okay.
Anybody else wishing to testify on SR 44, SCR 45? Come on up. Okay, identify yourself.
Aloha, Chair and members of HHS Committee. My name is Margaret Mejia. I'm testifying on behalf of Hawaii Christian Coalition. We oppose these resolutions. We are against abortion, and this medical procedure has not been founded to be safe and effective. There's also legal ramifications, including I don't know how to pronounce the name of the drug, but the drug going into the water. Thank you. We oppose.
Thank you very much. Anybody else wishing to testify on SCR, whatever that was? 45 and 44, SR 44. Come on up. Okay, because I really don't have much time. Anybody else after her needs to stand in line.
I'll make it quick.
Thank you.
Loretta Dubin, RN. I just want to say I am an advocate for patients, and I am all about people being supervised. If you give this mifepristone, you send the patient home, who's watching them? Okay? They could very well bleed out also. So we need to be careful about saying what is safe and effective. That's all. Thank you
very much. Okay, anybody else on SCR 45 and SR 44? Come on up. I mean, really, I really don't have any time here. So, anybody else behind her could?
I am Teresa Armbruster again. I just wanted to add one more
Oh,
thing.
you already testified. You cannot, sorry.
Just advocate safety precautions.
I'm sorry.
Okay.
Anybody else who hasn't testified? Okay, members, any questions? Okay, moving on. SCR 27, urging Maui Health to collaborate with stakeholders to establish a full-time medical residency program on the island of Maui. Okay, we have University of Hawaii in support, Maui Health System in support. Anybody else on SCR 27, members and questions? There's no one to ask questions of. Next are That's it,
That's
SR
it.
24. Okay,
Last
can we
thing.
move on to decision making?
We may.
Okay, first up, we have for SCR 30, because of the problems with the specificity, recommendation is to defer. For SCR 35, same thing, to defer because of the specificity requirement.
Yep.
Okay, same thing with SCR 18, sorry, for ketamine, defer, because of the auditor's requirement. SCR 76, biomarker, passed with technical, non-substantive amendments needed for clarity and consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay.
Passed with amendments.
Recommendation SCR 76 is Senate Draft 1, noting the presence of all members except Senator Kahole. Are there any WRs? No. Seeing none, recommendation adopted.
SCR 51, recommendation is to defer, because it's unnecessary for auditor. SCR 150, SR 141, Chair's recommendation is to pass as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, as is.
Okay, recommendation 141 is opposed as is, noting the previously excused member. Any WRs? No. Seeing none, recommendation adopted.
Okay, for SCR 119, SR 112, state staffing measure, we are gonna accept, the proposed amendment of what the State House did, which is inserting the amendments on HCR 105 to SCR 119, and same with the counterpart for SR 112. Passed with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation SCR 119 is Senate Draft 1, noting the previously excused member. Any WRs? No. Seeing none, recommendation adopted.
For SCR 149, Chair's recommendation is to pass with technical, non-substantive amendments needed for clarity, consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Passed with amendments.
Okay, hold on one second. You're going to pass.
149.
149, okay. Pass with amendments, noting the previously excused member. Any WRs or no's? Seeing none, recommendation adopted.
SCR 63, SR 57, this is the deaf hard of hearing. Chair's recommendation is to pass with technical, non-substantive amendments needed for clarity, consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on SCR 63 is to pass with a Senate Draft 1, noting previously excused member. Any WRs or no's? Seeing none, recommendation adopted.
For SCR 75, SR 69, this passed. The Chair's recommendation is to pass with amendments. We're gonna remove judiciary. We're gonna, change the session requirement to session 2030 for the report, and add the phrase, using the results and findings from the 3-year pilot program after the word plan on page 2, line 17. So pass with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation SCR 75 is Senate Draft 1, noting the previously excused member. Any WRs or no's? Seeing none, recommendation adopted.
SCR 21, SR 18, Chair's recommendation is to pass with tech amendments needed for clarity and consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation SCR 21 is Senate Draft 1, noting the previously excused members. Any WRs or no's? Seeing none, recommendation adopted.
For SCR 7, SR 7, Chair's recommendation is to pass as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Sorry. Okay, recommendation on SCR 7 is to pass an amendment, noting the previously excused member. Any WRs or no's? Oh, no vote for Senator Vela. Any more? Seeing none, recommendation is adopted.
For SCR 45, SR 44, Chair's recommendation is to pass with amendments. We're going to accept Department of Health comments, basically remove the word urge, and urging, and substituting with the word supporting, and add at line 26, whereas the Department of Health is committed to monitoring a 3-year supply, and the current expiration date of mifepristone supply is 2029. And any technical, non-substantive amendments need for clarity, consistency. Any comments, questions, concerns? Pass with amendments.
Okay, recommendation SCR 45 is Senate Draft 1. Of all members present, any WRs or no's? No vote for Senator Favela. Anybody else? Seeing none, recommendation is adopted.
For SCR 27, SR 24, Chair's recommendation is to pass with technical, substantive amendments needed for clarity, consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation SCR 27 is to pass with amendments, noting the excused member earlier. Any WRs or no's? Seeing none, recommendation adopted.
We are adjourned. Thank you.